The World Health Organization has flagged 7 syrups made in India during its investigation into adulterate medicines and syrups linked to over 300 fatalities worldwide. The UN body has also issued warning about the cough syrups produced in India that were previously associated with fatalities in Uzbekistan, Gambia, and Nigeria. According to reports, medications like vitamins and cough syrups produced by a number of Indian pharmaceutical companies are the reason behind many deaths in these countries. In response to the concerns over the reported deaths due to the contaminated India-made cough syrups, 71 companies have received show cause notices from the government and 18 of them have been instructed to shut down. The 7 India-made cough syrups flagged by WHO are promethazine oral solution, Cofexbalin baby cough syrup, Macof baby cough syrup, Megrip and cold syrup, Embronol syrup, DOK1 max syrup, and guaifenesin. Union Health Minister Mansukh Mandavia emphasized India's zero-tolerance policy on spurious medicines. He stated, and I quote, "We are the pharmacy of the world and we want to assure everyone that we are the quality pharmacy of the world." The minister further explained that an extensive risk-based analysis is continuously conducted to ensure the production of quality medicines in the country. The government and regulator are vigilant in ensuring that no one dies due to spurious medicines. To address the concern regarding the export of cough syrups, India has implemented mandatory testing from June 1st of cough syrups before they are shipped. The exporters are now required to provide a certificate of analysis issued by a government laboratory before sending out the medicines abroad.
Subscribe to One India channel and never miss an update.